In 2016, the International Review of Psychiatry published a reviewed article titled Gender Dysphoria in Adolescence. The studies sought to identify and understand gender dysphoria in adolescents, identify the characteristics of referral patterns to specialized clinics, and to discuss any etiological factors and co-occurring psychiatric problems present in adolescents with gender dysphoria. The authors noted that since approximately the year 2000, there has been an increased seeking of healthcare providers in various healthcare settings for support services for GD adolescents. Due to this increase, the authors used several relevant studies to assess current common treatment practices and define best practice mechanisms for the mental health, physical, and surgical well-being of adolescents with gender dysphoria. The DSM-5 places this gender dysphoria diagnosis into two categorical criteria subsections. This article only focused on adolescent aspect, suggesting that prior adage of transsexualism with gender incongruence. The article set out to define different areas of gender dysphoria and its attributes. Gender role or expression refers to outward behavioral aspects of gender through mannerisms, clothing, posture, and other factors that a specific culture might associate with a specific gender. Gender nonconformity, or GNC, is an expression of gender that is non-stereotypical for a specific culture based on an individual's assigned gender. Individuals describe their associated identities in such ways as transgender, which is an umbrella term used to describe individuals whose gender identity differs from their assigned birth gender based on their biological sex. Gender binary or gender queer are identities that are not exclusively male or female. And cisgender defines the exact opposite of transgender. This is used when individual gender identity and expression coincide with assigned birth gender. The term is noted to have helped raise needed awareness about the connection between human gender identity and human physical anatomy. In the development of adolescent gender identity, gender dysphoria may begin in childhood and continue into adolescence and into adulthood. This is considered early GD onset. Gender dysphoria may also begin around the start of puberty or even into adulthood, and this is considered late onset GD. Adolescence is a crucial time for GNC youth. The authors state that studies have shown that gender dysphoria is primarily influenced by peer interaction, emergent puberty, and the romantic experiences of adolescence. In fact, if GD behaviors begin in this period of development, it is likely that gender dysphoria will continue into adulthood. The authors of the review refer to a study done in gender dysphoric adults reported that biological female adolescents reported more cross-gender behaviors in childhood compared to boys. As far as sexual orientation and gender dysphoria, the authors point out that prior studies have been inconclusive regarding the outcomes of sexual orientation and its association to adolescence with GD in adolescence and into adulthood. Since around the year 2000, there has been a marked increase in adolescent females seeking gender identity treatment, which surpassed earlier studies where child referrals were more predominant. The authors note that in more recent years, biological females are presenting at higher rates than biological males from the years 2006 to 2013. This could be attributed to the suppression of puberty and the increased visibility of transgender in the media and the internet. Currently, when this article was written in 2016, it was thought that GD, gender dysphoria, is the resulting factors of physiological, psychological, and social aspects and influences. Co-occurring psychological functioning. Cross-clinical studies suggest that differences in co-occurring psychological diagnosis are due to cultural differences, peer acceptance, and societal tolerance to GNC youth. Anxiety, depression, self-harm, eating disorders, mood disorders, substance abuse, and problems with peer, familial, and romantic relationships occur. Risk of suicide ideation, suicide attempts, and suicide are real possibilities for adolescents with gender dysphoria before treatment or gender reassignment. This may be due in part to adolescents' all-encompassing focus on being another gender. This preoccupation may lead to truancy issues due to social and peer pressures, resulting in poor academic performance, higher dropout rates, and unemployment. and adolescents with GED often suffer discrimination and stigma, and less access to appropriate and experienced mental and medical health services is difficult and a real challenge. Treatment and implications. Multidisciplinary capacities must work together to assess the degree of social support and provide advocacy and support. They need to assess for co-occurring conditions and treat conditions appropriately with regards to individual safety. Assess medical history, assess puberty advancement for physical treatment considerations, assess and implement supportive therapy, and discuss reversible, partially reversible, and irreversible interventions with clarity and knowledge. The article conclusion. The authors note that physical and emotional maturity are both critical considerations when assessing and treating transgender adolescents and must be involved in the conception, development, and implementation of programs to assess gender dysphoric youth. Current clinical trends for GNC youth do not view transgender identity as pathological, and clinicians should support the individual person in what makes the individual feel most comfortable. The authors conclude that clinical best practice requires that all treatment plans for adolescent GED youth need to be individualized and follow an affirming care model. This includes the completion of a comprehensive psychological assessment before moving towards surgical avenues. Because adolescents are presenting with increasing complex and psychiatric comorbidities, further explanation into current and future medical, behavior, and health support treatment options that affirm personal gender expression and role will lead to effective long-term solutions, including hormone therapy, surgery, and behavioral therapy.